I feel like we're starting every video this way, but it's still true. Big changes are coming to Medicare in 2026, and these are changes that many people still can't quite fully grasp. Doctors are warning that payment rates are squeezing their practices. Telehealth flexibilities put in place during the pandemic may be expiring. Benefits may be cut in ways that don't show up in your Medicare card, but could affect how fast you access care, what kind of care is accessible, and how many providers will accept Medicare. So stick around, because by the end of this video, you'll understand what's changing, how it will affect patients and caregivers, and what you can do to protect your care. But before we get into it, if you could pick one aspect of Medicare to improve or change, be it dental, vision, telehealth, let us know in the comments below. And of course, if you're new to this channel, make sure to subscribe. We'll keep you up to date with these changes as they come. So let's start with what they call Medicare physician payment rates, because, believe it or not, physicians and medical groups say that they're currently in a precarious financial position. Now, why is that? Because although CMS is proposing a 3.62 bump for 2026 under the physician fee schedule, which includes a 2.5% payment adjustment under the One Big Beautiful Bill Act, that's after a 2.83 payment cut for 2025 that's already hit their practices. But the problem goes deeper. Practice costs such as staff, insurance, regulatory burdens, etc. have been rising significantly and have possibly outpaced these physician increases, leaving their margins razor thin, or even negative in some cases. Sources note that physician payment rates haven't kept track with inflation or practice costs, so even this promised increase could really be more like a break even. So how does this affect you? Well, if doctors are financially squeezed, there could be less willing to accept Medicare, meaning fewer visits, less services offered, or more wait times. Rural and underserved areas may feel this way more severely. When reimbursements are low, doctors or small practices may decide they don't have the bandwidth to take on new Medicare patients or may reduce services. Also, some services are just more expensive to provide, things like complex cases with higher overhead. In these cases, physicians may no longer offer these services, or they may push patients towards more expensive settings. So, while benefits on paper may stay the same, actual access may degrade. And that's a very important point, because while your actual Medicare benefits may not diminish, how fast you can be seen, how far you have to travel, and what services are offered may be affected. Now let's switch gears and talk about telehealth, which is an extremely convenient service that was offered by Medicare during the pandemic. This is one of the biggest areas where patients have recently felt benefit reductions. It was massively expanded during the COVID-19 public health emergency to allow more services remotely, including from home without the restrictions of where the patient lives or having to go in person first. But many of these services are set to expire as of September 30th, 2025. These include those non-behavioral telehealth services. There were also waivers allowed for telehealth services targeting mental health and behavioral services. It eliminated the provision that you had to meet in person 6 months prior to being eligible for telehealth. But that is set to expire as of October 1st, 2025. Although in some rural areas, it may be expanded until January 1st, 2026. But there are bills in Congress working to extend or make permanent the telehealth flexibilities. For example, the Connect for Health Act of 2025, which would lift permanently many of the older restrictions. Telehealth and the payment rate will affect certain groups of people more than others. For example, if you live in a rural setting. Telehealth there has been a lifeline in areas with less access. Rollbacks of flexibilities will hit these groups the hardest. Also, if you're someone that actually utilizes mental health care offered by Medicare. With these waivers set to expire either October 1st or January 1st, that will significantly limit the flexibility of those seeking mental health or behavioral health care. The waivers expiring will force more in-person meetings, which could mean travel burdens or delays. And of course, for those that are homebound or with limited mobility, telehealth meant accessing quality care without having to leave the home. Now currently, almost all hospitals and doctors accept original Medicare, but with the less than desirable physician payment rate having not increased as much as they would have hoped, would this change? Would doctors and facilities begin to jump ship? With decreasing reimbursement, rising costs, and regulatory burdens, some doctors may decide they can't make Medicare work financially. They could limit the amount of new Medicare patients they accept. They could reduce their hours, or they could reject Medicare entirely and opt for self-paying patients or those with private insurance where the reimbursement rate is just better. What are your thoughts? Let us know in the comments below. Of course, if you have questions, you can reach us there in the comments or at the number on the screen. We're licensed health insurance brokers. We're licensed nationwide, and there is absolutely no charge for our services. So please feel free to reach out with any and all questions that you may have. Now, we do release these videos on a weekly basis, so please make sure to like so that way we can get this information out there, and subscribe to stay up to date, because I cannot stress this enough. There have been more changes than possibly ever before to Medicare that we've been reporting on, changes that are being enacted now and in 2026. So make sure to stay tuned. But there's actually some good news. Stakeholders have been putting pressure on Congress to address these issues, the issue of telehealth and the physician reimbursement rates. These crucial stakeholders are urging for more stable reimbursement with less volatility from year to year. For telehealth specifically, there are several bills, such as the Connect for Health Act of 2025. This is a bipartisan proposal that would make many telehealth flexibilities permanent. And the Telehealth Modernization Act, which is also aimed at extending or making permanent telehealth access. If these are important to you, make sure to contact your representative. So if you are a Medicare beneficiary or someone who is soon to be a Medicare beneficiary, there are several things that you should do. Number one, make sure to stay up to date and be aware of any announcements coming out of CMS. Also, if you're someone who relies on telehealth, make sure that you choose a plan like a Medicare Advantage plan that offers telehealth. Additionally, make sure to have an honest conversation with your doctor and make sure that they will continue to accept either original Medicare or your specific Medicare Advantage plan. As always, if you have questions, you can reach us in the comments below or at the number on the screen. We are licensed health insurance brokers. We're licensed nationwide, and there's no charge for our services. Also, if you'd like to learn some more about some of those additional Medicare changes for 2026, I highly recommend this video over here. You can also check out our All About Medicare playlist. And before you go, don't forget to like and subscribe. We'll see you next time.